Hello, hello everyone. Thank you for joining me today. Before I proceed, I just wanted to check if this is audible. Kola, can you listen to me? Is this audible? You're able to listen it, Komla? Hello, mic testing. Hello, hello, hello. Okay. So, as I said earlier, thanks for joining. My name is Teju, and I run an organization called N Smiles. And I have been a TEDx speaker on mind wellness. And I have been recently awarded the 51 Top Fabulous Global Happiness Leaders Awards. As part of NSmiles, we develop self care apps for students and for adults, especially for people who are working, for pregnant, and for homemakers. What does the app do? The app provides four exercises every day, and since self care is very, very personalized, we ask them to go through the exercises, whichever is most suitable for your need, so that every day you will be able to relax your body and mind. You break away from your negative thinking, you enhance feelings of positivity, hope, optimism, you sleep deeply, and overall you will have confidence to be fit emotionally as well as physically. So that's what we do. You can download Happy Being app for yourself, and if you have a teen kid, you can also download Student Success app, which both of it takes care of your well-being. That's shortly about me. The app also has a 7-day free trial, so you can try it out. And in case if you like it, you can subscribe for it. So today I would want to cover a couple of topics on self-care, and I thank BabyChakra for this opportunity. Last week we have discussed about how we can self-care, but then I thought, instead of assuming that we all know the need for self-care, which is maybe not, we will first go the reverse way, which is first understanding uh, why is it important to care about ourselves through self-care. So to understand that, I will shortly talk about what is well-being, what are the factors influencing well-being, what is the relation between stress and optimal well-being, and then what could happen the relation between stress and poor immunity, and then what are the advantages of self-care. All right. So according to WHO, and after that you could also ask questions. So, according to WHO, well being is a state of mind where you feel healthy, happy, and successful. It also includes achieving your true potential. You be satisfied with your life. You can cope effectively with stress. You have a close, emotionally connected relationships, and you lead a life of purpose and meaning. And when it comes to factors that influence well being, we usually think well being is either physical. In India, especially, well being always means physical health. But then there are multiple facets of well being, multiple areas of well being. which also are like your physical health, your mental health or emotional health, your social health, your financial health, your environment, your spirituality and purpose, then your family. So there are multiple, and your career, of course, multiple facets of it. So for a person who is very good with your physical well-being or a high sense of well-being from the physical standpoint, may take healthy choices when it comes to their diet, exercise, their lifestyle choices like drinking, smoking, use of substance and stuff like that. Also they take care of their sleeping habits. And somebody with the optimal mental well-being can have a very good self-esteem, have an optimistic outlook towards life, knows how to handle their stress, or engage in practices that enhances their positive moods and emotions every day regularly. And then somebody who is good with social, they can engage in fun hobbies or some leisure pursuits which help them relax, connect to their people around. uh, they regularly volunteer on causes which are close to them, and then they have a close network of friends and family. And then somebody who is having a good family health essentially feels connected at home. They feel safe, they feel supported and belong, both from the members of the family and the spouse. And when it comes to financial well-being, you feel you have enough money, and then you have enough, a sense of abundance, not like lack or deficit when it comes to money. And then when you come to career well-being, for those who are working, they are firstly, they love their work, they're engaged at their work, they're in a constant state of flow, which we call like, whenever you're working you miss out on time. You're just so absorbed in that work that you feel key, already it's been like so many hours since you're done work. So that's what is, when you're in a high state of flow, you feel so. And then when you're having a high optimal state of well-being when it comes to career, you'll also have achievable, you'll set goals basically and work towards it. And then you will have, you'll be curious to learn, you'll have curious to understand things around you from your work. You're not limited to your own work, but you also wants to, you constantly look for opportunities to grow and go ahead in your career. So that's the signs of people who are having very good career well-being. And for someone who is good with spiritual well-being, lead a life of purpose, meaning they regularly engage in spiritual and religious activities. Um, they feel everyone is connected. And then environment, though there is a very huge context when it comes to well-being, it also involves having some regular, that there is environmental safety also includes how safe you are, how much you are in reach with the basic amenities like grocery amenities, hospital, park, or school. This also is environmental well-being, but these are things which are driven from the government policies. So when it comes to our environmental well-being, the minimum we could do is create a safe green home or regenerating home, where when we are stressed, we know that getting into this place can help us relax and regenerate ourselves quickly. So these are all different facets of well-being, and each of these well-being is interdependent, meaning, say for example, I have poor mental well-being. So what I do, I feel low or I feel through negative emotions, and then that negative emotions will cascade into me not being friendly or not being close enough with my friends and circle family, which impacts my family well-being, my social well-being, because I am not inclined to move towards engaging any social activities with people around me. And then maybe because of my moods, I may not be more inclined towards doing any physical activity, so that will indirectly impact my physical well-being. And when I'm not active, when I'm not able to concentrate well, I will not be able to do the work with fullest of my ability. So that it also impacts if I'm working outside. If I'm working at home, the quality of the work deters, or there could be some glitches in the continuity of work, where I'm not having energy, I don't feel like doing, and I ignore my own health. At this stage, it may also impact your day to day activities, which are very important for your baby care. So it is all interdependent. So we can't just say that, "Acha, I'm taking care of one aspect of well being, so I'm covered." No, it's not that. Maybe taking care of your mental well being, everyday exercising, or taking care of your physical well being and your social well being can somehow act as a protective layer when it comes to managing your overall well being. But it is a protective layer, it can't just stop from your well being getting into poor well-being if you don't care about it at different points when there is a need to care about it. So I would stress upon the point key, it's just not important you care about one aspect of well-being, but you care about every aspect of your well-being to live a very fulfilled and satisfied life. And when it comes to the current situation where we are we're working from home, both if you're working, you and your spouse could be working. If you're a homemaker, you'll see that your spouse is continuously at home with no little help. And then because of the lockdown, at most of the places we don't even get domestic helps. And it is very very natural that we are quickly drowned into feeling of helplessness, tiredness, lack of energy, or having a lot of stressful emotions in terms of managing your day-to-day life. Um and then what happens when we are not caring about them? It may slowly start impacting your health in an overall perspective, and especially during this time, going through a lot of stress may not be very beneficial to you and your baby also. But then we can't say that, I'm not saying you could avoid going through these emotions. These are part of it, because naturally when a ward next to us is having contamination, we also may feel fear of contamination. Or when we are ordering grocery, or when we are ordering anything through Amazon or Flipkart, it's very very natural ki we also have a sense of doubt, and then some fear, worry. Or our parents are staying in next places, not with us but in another town, with and already if they're going through some kind of hypertension or diabetes, we already have this kind of a small inclination towards getting fearful ki what if they catch, and who are there to care about them and stuff like that. So I'm saying having some amount of stress or feelings of emotional drain is very very normal at this time. And then to top it, you are also having your own hormonal, because of the hormonal changes. There is a very very high chance of mood changes due to pregnancy. So one layer is the normal stress, where we are managing it normally. On to top it, because of the situation, we have an additional layer of stress. And along with this, again, you are pregnant. So with this situation of COVID, we have an additional layer of stress that is always constantly there within us. We talk about it or not, we deal with it positively or not, but we need to at least agree that yeah, we go through these kind of emotions at a day-to-day basis more frequently than earlier, because we can't go out. So how much ever we stay at home, there's a possibility that there could be quarrels happening between families, or not able to cook well because of lack of energy, and husband is always on calls and stuff like that. And then I'll not say for everyone, but especially for couples whose spouses are into software, or they're into support, where they're supporting someone over calls. So, but India is a services company. Most of us are in that space. So it's very, and for people who are at home, and they don't go through any of this. Like there's a lot of support system. even then it's very important that you understand what all compromises of well-being. So if there is any place your well-being is compromised, you know how to you know to catch it and care about it very early, so that we don't have to face the complications because of it. As we established that well-being is a holistic phenomena, and due to the COVID or the pregnancy or the situations today, or to my own, I mean, even where I am at today, even start of my journey in this as at a place of my own well-being, there's a lot of factors that adds to our stress in a day-to-day basis. We have established so far till there. And now I'll add one more complexity on to top of it, which is the proven result that the stress will impact our immune system. So, I'll talk a little bit of our immune system. We all know immunity, resistance, power from a word point of view if you're not doctors. So, well, I'm also not a doctor from a medical point of view, but I will try to explain it from a layman language where you and me talk about it kind of stuff. So, our immunity system compromises of billions and millions of cells that go through our bloodstream, and these uh, cells, they go into our tissues, into our organs, and what do? They defend our body against any foreign body particles like your virus, your infection creating cell or cancerous cell, any kind of foreign bodies it will try to protect. And of course you also know that these immune cells are part of our white blood corpuscles. And but the thing what we I want to stress upon today are about your B cells and T cells. And these B cells and T cells are the ones which are active, which play a very active role when it comes to your immunity protection or immunity enhancement. So the B cells, what do? They produce these antibodies. They train them. What do you have to do? How do you recognize this cell is a normal cell or a foreign cell? And they train your system. The B cells are the one which are responsible for the fluid that gets released, and they surround the body. They destroy the virus, and especially are act like an attacker. And then the T cells are another kind of cell. They also go along with B cells, and then they call these people and they go to the infected cell, and essentially they crowd them and they attack them and destroy them. So they it's like, for an analogy you can say that there's an enemy guy. You've all seen Bahubali movie, right? So the people who are coming from another Raja, you have so much of VFX works which sees that there's so many people attacking this kingdom of Bahubali's thing. Those are all like, how if you imagine Bahubali guy as a foreign invader, and these T cells and B cells are all those VFX soldiers which attack you and come and try to attack you from different areas, so that the foreign party is completely eliminated and killed from your body. Okay, so we can just say that way, for example. And what happens when you are stressed? The stress is generally a fight and flight moment. So fight is you're fighting, flight is you're running away. Running away means, see, if you see a tiger, how do you run away? So that's the same thing. So you try to avoid, you try to, if you steer past when there is a stressor, you say, oh God, you don't want to touch it. You just, that is flight, going away, or you know how to manage it or facing it. So what happens when you're stressed is, there's a hormone called cortisol that gets released, and this release of cortisol, the stress hormone, can suppress the effectiveness of how this immune system functions. Means how this B cells, means how they produce your antibodies, or how they surround and attack. Both this functionality they will reduce, because of which they say stress has an effect on your immune system. So when you are stressed in any form, uh, be it from fear of getting disease, or panic of somebody dying out of it, or irritation, or with a lot of things closed, how will we go to hospital, and what happens when I catch contamination there, what happens to my baby, different kinds of thoughts and thought process, or fights in between couples, or between in-laws and the you and your in-laws, or you and your parents, whichever way. It all weakens the immune system, with the where it affects is the ability to fight against these antibodies. So what happens when the ability to fight for your immune system compromises, then your susceptibility to get that disease increases. Or when you are going through any kind of health issue, the ability to recover from them is weakens, so it is delayed. So that is the reason. I'm not saying for every stress, I will talk about acute stress and chronic stress in a while, but let us assume because of the situation there's most probably that we'll be going through these emotions in a more frequent way. So that is why the more frequent we go through these emotions and we don't care about it, or we caring is how we can convert them into some positive or do something to help them utilize that effect, the immunity gets compromised. And when immunity gets compromised, it also affects our, not only just, but we all see multiple places where impact of stress on the inside fetus. So it also affects the baby inside. So that is one of the, it only, not only the stress not only affects the immunity but also the baby inside. Now think about people who are already going through at the risk of blood pressure, or or already having some kind of, are at risk at pregnancy. For them it is little more. So so I mean, I'm not trying to uh, create a fear out of Congress. I'm just trying to bring awareness on how stress can be detrimental to our health. If you already know, it is a reconfirmation. And then the other point I would want to stress is when you're eating and there is food in your stomach, stress will inhibit the digestion process. So when you're stressed, it just stops, the digestion stops. Because of that, you may also have a feeling of bloating and stuff like that when you're, or ulcer, gas kind of thing when you are going through stress. So these are all the symptoms, I mean effects of stress. Even for people who are going through fertility treatment, who wants to get pregnant, it is detrimental. Who are already pregnant, it's detrimental. Who are already at seventh, eighth stage, it's more detrimental. Because it's seen not just for the baby, but even after baby is born 10, 12 years old, even there we see the problems of this in terms of their temperamental issues, their aggressive behaviors. This is an area where uh, stress affects the baby in terms of getting speech disorders, autism. There are multiple things which can happen because of stress. So that is one area which I want to stress upon. So we all know we are stressed. So why is it difficult to understand whether my stress is something which is detrimental to my health and baby, or is it normal stress? Is it acute? Is what kind of, what in what area I can bucket my stress? This is some question which we usually don't know, because there is no scale from which we can identify where we are standing today. Because of that, what happens? Uh, uh, mm, Before that, before going to that, I also wants to talk about, when a little more fear to understand why self-care is so important. So this is all at a physical level. When you talk about mental health level, there are people already going through some kind of mental health issues. Say, according to WHO, they said that 1 in 4 go through mental health crisis. So means in among us, 1 in 4 are already going through mild to moderate levels of depression or anxiety or mood disorders, eating disorders, and some form of mental health issues. And for all those people, today we there are certain places where the medication is a must, so they give medication. But there are most of them, they may have to manage it with some kind of therapy and some kind of positivity enhancement exercises. So if we all, if these people also ignore to care about, it was already motivation will be very low, stress is high, what will happen to the newborn baby? Already we have 1 in 10 people going through postnatal depression. And postnatal depression is a very child goes through a feelings of not loved, because mother don't have the feeling of loving the baby when the baby is born because of her own blues. It is not only symptom, there's a lot of symptoms. That the one thing which we can say in one word is that mother feels she's not loving, when the child is not cared. So there's feelings of not lovable right from the time the baby is 10 days old, because that is when usually the mother discovers that there's a symptom of it, till it goes to 3 months. So one to, from the time the baby is born to 3 months is where In that 10 days where you usually get through with the symptom, if you are already going through that symptom of blues and having mood things and all that. uh, but imagine the baby, the feeling of not loud. Even today, when we are as adults, if we feel the feeling of not loud, you know, still we crave for it. Imagine that baby who's 10 days old, who have to go through all this just because we have not cared about our emotions when it was required. That is the impact I'm talking. If life is born and it feels for the lifetime that she is not loved. So it is such a painful thing to impart to the newborn, right? Without our knowledge. So that is where it is very, very important. But why I will definitely say no if any of us think that we are doing it intentionally. Because stress is such a tricky point. We never know where we stand on the continuum. We may be at the left side of the continuum where everything is green and everything is hazy, lovable, simple, soft, puppy love kind of stuff. But as you are going through these emotions regularly or a period of time, you slowly move towards right side of the continuum. If you imagine a straight line with left side being very good health and good optimal well-being, to the right side having very poor well-being. When you're on the left side, you're good, you care of your emotions, and you don't even bother. You'll be like okay stuff, which most of us do normally, unless until there is an awareness about taking care of it. That's why I had to talk about this in a more fearful aspect, which I usually don't like to do. But these are all facts. I have not created any story out of it. It's just there. I'm just trying to bring awareness. So please bear with me if this kind of conversation has induced any kind of small amount of stress in you guys. My intention is not to do that. So breathe, relax in case if it's causing it's stirring any kind of emotions. Deep breathe for 5 6 times till you feel that discomfort coming down. If any one of you is experiencing any kind of uh, any kind of discomfort. So the left side is the optimal health, and as you're going through these emotions, maybe because of uh, any kind of interaction with stress emotions, negative like fear, anxiety, worry, sadness, hurt, frustration, disappointment, loneliness, irritation, any of these things, as it goes you just keep ignoring. Means ignoring means you will feel stress or you will feel worry, but you will not do anything about it. You will be in that state. You will not think about how can I stop worrying. That is the thing I'm talking about. You'll be attaching with that worry and keep thinking about those for a longer time. That's the initial state. The second state is you see that the intensity of worry is increased. It moves into it moves into the worry moves into a little higher level of worry, getting into anxiety. Then once you get anxiety, it starts from very low anxiety where you see little signs of heart getting more palpitation. And slowly, even if you ignore the worry point, at some point you get into recurring thoughts of anxiety, recurring thoughts of worry. And the recurring increases, the intensity increases, you get into low to mild to moderate to little more on the severity, and severity to high anxiety. This is how it progresses in terms of mental health, unless until you are genetically having mental health problems. If you have already mental health problems and if you are stressed, you don't care about your emotional regulation, what happens is the intensity increases and it regulates with your day-to-day emotions, day-to-day functionality, you know which is really painful, not just for you but your baby. So it is very important for us to see where we stand today. What are the where how where am I when it comes to my emotions? It could be because of anything: lack of finance, career tension, or family tension, or physical tension, because of body aches and pains, or because of emotional disturbances. It could be because of anywhere. It is very important to understand where I stand, what kind of emotions am I going through, what is the, if I can label them, saying okay, this is something which is, I'm experiencing sadness, I'm experiencing worry, I'm experiencing hurt, and what do I do after it? that is where self care becomes very critical. Understanding what I am going through now, where I stand on this continuum, and okay, finance is not contributing to my stress. Okay, a family is not contributing my stress, or family is contributing to my stress. Understanding it, and then paying more attention what happens when I'm going through that stress, and trying to help myself deal with it from a more in control position, where I'm giving more love to it, more care to that part of my life, is something which I would say as a part of self care. So as a part of giving more love, more care, I engage in some kind of rituals in terms of practices which I do to achieve a optimal well-being, and this is called self care. So when you are regularly caring for yourself, what happens is you'll be more in a state to manage your stress in a more positive way. And when you are able to manage your stress in a more positive way, stress is some, I'm using stress as a word for negative emotion, any kind of negative emotion. I will not say you can't face negative emotion, you can't experience negative emotion. Any emotion is healthy, but when you face negative emotions for a more number of times at a more intense level, it gets into a problem. So we have to stop it. So we engage in different self-care practices. What are those self-care practices? It could be, as I said last week, it could be engaging to everyday exercises like yoga or a general walk, or you could do some kind of relaxation exercises like mindfulness breath, or some kind of breathing exercises, relaxation exercises. Or you could go through, when finances is your worry, two things, right? You could see about how I can save my fixed costs. You know, that will help you, give you some control. And the other thing is, when I am stressed about money, how I can relax myself. Same way it comes to career. One thing is how I can handle my first current stress in career. Second thing is how I can do better. So when I'm facing this kind of stress, how I can be mindful about my stress. So that is where we do mindfulness as practice nowadays. Everyone says mindfulness, mindfulness, right? What exactly is mindfulness? Would be to be mindful at that moment, not engaging with that thought, not talking about the thought, but be present, acknowledge, and move on. So when you are able to do these kind of things, it will help you prevent your diseases, because your immune system functions well. You can recover from your any kind of small health problems. You can sleep better. You will be able to focus more at work or whatever your work you're currently doing, because of your ability to manage your emotions in a more healthy manner. Your social health is also care. You will not fight, you will not react, you will respond. If there is a difference of opinion, you know how to handle them without causing any friction in that relationship. And also, you're very mindful about what you eat, your weight, and then you're not stuffing, you're not binge eating. You know your body is a temple and you have to respect it. Obviously you must be doing all this, but still, from a physical point of view, we have a lot of awareness. But that's why I'm not stressing more on your physical health. But because of the lockdown, there is a possibility that you're sitting at home. I please encourage you, don't do it. Talk to your doctor and try to find few exercises which are very safe to do during pregnancy. If you're already attached to a doctor who is already providing this, very good, please continue doing it. But additionally, with your physical, also please care about your emotional health. Try to do some deep relaxation exercise. As I said earlier, I have provided all this in the self-care app. Every day you can do whatever you like to do. You want to do affirmations, you could do affirmations. You want to do breathing exercises, we have provided it in the app. If you want to do mindful exercises, I'm a beginner to meditation, we have provided it like a transition phase where every day 10 minutes you are doing this kind of relaxation exercises or a mindfulness exercise. I'm a writing kind of person. I can do it through gratitude journaling. So we have provided all this in the app. Please download Happy Being app, and every day try to help yourself feel positive, optimistic. Every day you do one exercise or two exercises per day, either from affirmations or mindfulness or any kind of meditation, or any kind of relaxation exercises from anywhere. I will not say just do my product. I will not say that. Do it from anywhere. But for what you call simplicity, you put it everywhere in one place. So these are all the advantages of self care. Now, what I will do is my time is over. So anybody wants to ask some questions, I will be open to do it. Or next week we will continue this with a deep relaxation exercise on how you can relax yourself. An experience if somebody who is not used to relaxation exercises, along with what is the specialty of this, I would say, is using creative visualization as a technique. We are trying to give the feeling of how we can protect our loved ones using using the power of mind. This we will do in the next week. So please log in at that time also. So have any questions? So how can we care about our kids and ourselves? As I said, right? Ask them to engage in some physical activities. Ask them to practice gratitude. Ask them to engaged in some form of meditation. Ask them to get into. I understand everybody are now going through holidays, so there are a lot of children who are sitting at home watching TV or iPhone or YouTube or going through some games. And the games are also having the nature of killing each other, which is really really detrimental to their emotional health. So ask them to engage in some skills. There are a lot of YouTube videos which also teaches us how to uh, you know go through this kind of new learnings, new skills needed. So go through, ask them to, you help them go through a YouTube channel which is their liking hobby, maybe a guitar, dance, or art. Ask them to engage in some skill, learning some new skill, or these are the ways they can ask them to repeat their sixth, or if they are into fifth grade, ask them to repeat their math session, science session, some learning. Ask them to manage their time as they're doing some chunk, so that even if they're doing PlayStation or any kind of gaming which are very very stressful, they can compensate because of this kind of practices. And yoga, they can also do yoga. Both of you can do yoga. And then time to sleep. There are a lot of things these teenagers especially can do where they don't sleep on time. So please encourage them to sleep on time. Sleeping is very very important. It's like a nightful sleep can give you a nightful rest can give you lot and lot of right from removing toxin to regeneration. The sleep is such important activity for us. So please ask them to sleep on time. Generally, these are the ways you can ask them to do it. But as I earlier said, you can also download an app which is for students, for kids, which is called Student Success. It's available on Google Play Store, and for adults, you can do it using Happy Being app, which is also there on the Google Play Store. And I hope this session was really, really beneficial for you guys. And I intend to see you next week, probably. Until then, please engage in self care now that you know the importance of it. Alright? Okay, see you next week. Bye bye. And thank you for being with me. I really, really enjoyed Baby Chakra. Thank you so much. Bye.